Another edition of your weekly program, African Union Journal on Africa 24. Hello and thanks for joining us. The African Union Journal brings to you updates on the actions of the African Union. Non-communicable diseases are a public health problem in Africa. The progression of these diseases is closely linked to the level of socio-economic development of a country. Lack of education, poverty, and other social determinants are associated with these diseases and their risk factors. On the continent, the Africa Centers for Disease Control and Prevention is implementing strategies for the control and prevention of non-communicable diseases. Details in this report. According to the World Health Organization, of the 38 million deaths caused by non-communicable diseases in Africa in 2012, 16 million or 42% were premature and preventable compared to 14.6 million in the year 2000. On the continent, the Africa Centers for Disease Control and Prevention, a specialized public health agency of the African Union, intends to play its part in reducing the spread of these diseases.
Africa CDC is committed 200% to ensuring that what we are agreeing on today, what we are launching today, is going to be implemented to the best of our resources and abilities. We shall work with each and every country, each and every partner, so that we see this strategy not only being implemented, but being implemented efficiently and to the benefit of this continent. We really must show
the health agenda of African countries and of the members of the African Union is gradually converging towards the reduction of non-communicable diseases and mental health problems, which have been at the heart of the concern of states for decades. Actions are on the way to deal with these pathologies, as well as the problem of injuries caused by natural disasters and conflicts, among others, a difficulty accentuated by the disruption caused by the COVID-19 pandemic.
We started the most complex and challenging period of implementation of this strategy over the coming 5 years. And I believe that we need many meetings to exchange our experience, share our ideas, discussing the difficulties and challenges to reach to the best outcome after the end of this initial period. I wish all the member states to take the implementation of this strategy as a top priority.
The Ethiopian government has started giving priority to non-communicable diseases and mental health problems, as well as the problem of injuries caused by natural disasters and conflicts, amongst others, especially in the last 10 years, with the adoption of a transformation plan of the health sector and the development of specific strategic plans for the implementation of integrated prevention and care services with emphasis at the primary health care level.
We have now at least one center per district offering cervical cancer screening and treatment services, which is a total of more than 1,000 health facilities at the lower level. We're also expanding radiotherapy services for cancer. Emergency services have been revamped through introduction of our pre-hospital care services, including our comprehensive emergency and critical care strategy. We are decentralizing diabetes and hypertension screening and management.
All actors within the Africa Centers for Disease Control and Prevention and the African Union Advisory Group are reassured that their efforts are appreciated for what is being done. Also, Africa CDC intends to do much more, and the implementation of the strategy is on the way. Africa accounts for only 3% of global drug manufacturing. With the implementation of the African Medicines Agency, the continent is expected to make significant progress in regulating pharmaceutical products and improving access to quality medicines. The objective of the African Union is to meet more than 60% of the continent's vaccine needs by 2040. More in this report. With the launch in 2019 by the African Union of the African Medicines Agency to ensure greater access to effective health care in Africa, the continent is expected to make notable progress in the regulation of pharmaceuticals and in improving access to quality medicines. According to African governments, it is urgent to strengthen above all the local production of vaccines in order to respond effectively to the needs of the population.
One of the most important developments since our last meeting is the entry into force of the new African Medicines Agency. It is essential to maintain the momentum and fully establish this agency, without which Africa cannot independently authorize and regulate medicines and vaccines. Producing vaccines on our continent is also an opportunity for trade and investment.
In 2020, Africa accounted for only 1.1% of the global pharmaceutical market. Drug manufacturers on the continent are only about 375 in number and are mostly located in the north, according to the World Health Organization. The entry into force of the African Medicines Agency is expected to redress this situation in a continent that accounts for only 3% of global drug manufacturing.
Si nous voulons justement être en bonne santé, il faudra qu'on réfléchisse à produire nous-mêmes nos médicaments. C'est pour ça l'agence des médicaments est salutaire et les discussions actuellement sur Africa CDC donnera plus de pouvoir à cet organe de l'Union africaine pour nous permettre d'aller justement dans la dynamique de soigner nos populations.
Several African countries like Ghana, Egypt, Algeria, and South Africa are currently engaged in the production of vaccines to meet the needs of their populations and also for export purposes. Through the African Medicines Agency, Africa intends to strengthen vaccine manufacturing in order to meet more than 60% of the continent's needs by 2040.
So we're busy working under the Partnership for African Vaccine Manufacturing to also create such centers to support regulatory system strengthening, especially now that the continent is moving into facilitating production of vaccines to attain 60% of the continental need by 2040.
According to health experts, pharmaceutical expenditure in Africa is expected to reach $30 billion by the end of 2022, and the value of the African pharmaceutical industry will be worth $56 billion in 2030. The issue of migration and health remains a major concern within the African Union. The institution is working to address the current health challenges of migrants and refugees in Africa, while the outlook for migration shows a possible increase by 2050 due to several socioeconomic factors, according to the International Organization for Migration. Let's follow this report.
The African Union Commission Chairperson Moussa Faki Mahamat welcomes the outcome of the second Heads of State conclave on the Democratic Republic of Congo, particularly the decision to immediately deploy a regional force to restore peace and stability in the DRC. By the way, the Chairperson of the African Union Commission congratulated the President of the Republic of Kenya, Uhuru Kenyatta, and the Eastern African leaders for their common efforts towards finding a sustainable solution to the situation in Eastern DRC and the Great Lakes regions as a whole. The consultative dialogue held between the African Union Commission, the African Union Development Agency, the New Partnership for Africa's Development, and other stakeholders working on human capital and childhood development, held from April 25th to the 26th, 2022, was an opportunity that enabled stakeholders to exchange and share their experiences and good practices in finding solutions to eliminate malnutrition in all its forms. This dialogue, however, opened discussions on strategies to implement so as to strengthen agri-food, health, and social protection systems for the acceleration of human, social, and economic capital. However, the outcomes of this meeting are still awaited. The African Union Commission and the Food and Agriculture Organization of the United Nations have launched new guidelines for scaling up investment in agri-food systems for young people in Africa. These guidelines are intended for those involved in the design and implementation of agribusiness investment programs such as governments, financial and technical partners, the private sector, civil society, and young women and men. According to the General Director of the Food and Agriculture Organization, there is an emergent need to address the gaps and multiple constraints young Africans are facing, particularly those in rural areas.
The fourth ordinary session of the Specialized Technical Committee on Migration, Refugees and Displaced Persons will be held from May 23rd to 24th, 2020 in Malabo in the Republic of Equatorial Guinea. This session of the Specialized Technical Committee on Migration will focus on the validation of an important legal instrument that will contribute to the operationalization of the African Humanitarian Agency, the governance of migration inside and outside the continent, and those of several policy documents that will enhance the effective governance of issues concerning migration, refugees, and IDPs in Africa. The Extraordinary Summit of African Head of State, Industrialization and Economic Diversification of Africa will be held from November 20th to 25th, 2022 in Niamey in Niger. According to the African Union, this summit aims to highlight Africa's renewed determination and commitment to industrialization as one of the pillars for achieving the continent's economic growth and development objectives. The African Union Economic, Social and Cultural Council will in December 2022 hold the civil society organizations elections to constitute its fourth permanent General Assembly. The decision was confirmed at a joint Economic, Social and Cultural Council Credentials Committee and African Union Commission interdepartmental meeting from March 21st, 2022 in Zambia. The meeting was premised on the decision of the 40th Ordinary Session of the African Union Executive Council of February 2022, which requested the African Union Economic, Social and Cultural Council Secretariat in collaboration with the relevant departments of the African Union Commission to launch the call for applications on the fourth Permanent General Assembly of the Economic, Social and Cultural Council during the second quarter of 2022. During the meeting, the Credentials Committee of the Economic, Social and Cultural Council and the African Union Commission interdepartmental team developed a roadmap for the election of the fourth Permanent General Assembly. It should be noted that the African Union Economic, Social and Cultural Council is mandated to actively engage civil society in the processes and work of the Union, particularly with regards to Africa's integration and development.
The native from Niger, Ibrahim Assane Mayaki, is the Chief Executive Officer of the African Union Development Agency, AUDNEPAD. He has held this post since January 2009. For several years, he has been committed to supporting the development of industrialization and the integration of the African continent into international trade and to supporting the health systems of African countries. More about Ibrahim Assane Mayaki in this report.
Ibrahim Assane Mayaki currently serves as the Chief Executive Officer of the African Union Development Agency. As the continent gradually recovers from the COVID-19 pandemic, Ibrahim Assane Mayaki insists on the importance of focusing on quality infrastructure, skills development, and strategic specializations for effective economic recovery.
Africa's industrialization challenges and the subsequent low participation in global value chains are real and they require structural solutions. Without the macroeconomic fundamentals in place, special economic zones will not have anything more special than our countries of enclaves. This is why investment in quality infrastructure, skills development, and strategic specialization.
Ibrahim Assane Mayaki's areas of expertise include industrial development, sustainable development, the mining sector, and also education. He places human capital development, technology and poverty, sustainable development, the mining sector, and also education. He places human capital development, technology and poverty reduction at the forefront of Africa's industrial development strategy.
The Accelerated Industrial Development Strategy of Africa, AIDA, offers a solid framework to strive and adjust its participation to the global value chains. Indeed, IDA puts human capital development, technology, and poverty alleviation at the forefront of Africa's industrial development strategy.
Ibrahim Assane Mayaki was Prime Minister of Niger between 1997 and 2000 before assuming the post of Chief Executive Officer of the African Union Development Agency in January 2009. According to him, the economic zones could play an important role in sustaining industrialization and integrating the African continent into international trade.
Special economic zones can play a role in sustaining industrialization and Africa's integration into global trade. Successful special economic zones should support economic diversification and strategic specialization in host countries by attracting high volumes of investment, domestic and foreign.
Author of the book Africa at the Time of Choice, Ibrahim Assane Mayaki holds a master's degree from the National School of Public Administration in Quebec and a doctorate in Administrative Sciences from the University of Paris 1 in France. He has worked as a professor of public administration in Niger and Venezuela.
And thank you for watching the African Union Journal. Join us next week for another edition.